Welcome to Level 2 module on Helping the Student with Diabetes Succeed, a guide for school personnel. Level 2 curriculum is for classroom teachers, coaches, and other school personnel who have regular contact with a student with diabetes. The Level 2 module builds on information received in Level 1. Covered in Level 2 are types of diabetes, understanding low and high blood sugar, impact of low and high blood sugar on learning, effective diabetes management in the school setting, planning for parties and field trips, and social-emotional issues. There are two main types of diabetes, type 1 and type 2. Both types are chronic conditions that affect daily life. The symptoms of diabetes include excessive thirst, frequent urination, exhaustion, and blurred vision. Symptoms can also include constant hunger and weight loss. If a student complains about these feelings or you observe these symptoms, talk with your school nurse. The first step in the development of type 2 diabetes is a problem with the body's response to insulin or insulin resistance. Obesity, inactivity, and family history of type 2 diabetes are major risk factors for the development of insulin resistance in type 2 diabetes. Type 2 diabetes is becoming more common in young people as the occurrence of childhood obesity increases. In people with type 1 diabetes, the immune system attacks the cells of the pancreas that make insulin and destroys them. Because the pancreas can no longer produce insulin, people with type 1 diabetes need to take insulin daily to live. Type 1 diabetes can occur at any age, but it most often occurs in children and young adults. Here's the process. You eat something that causes your blood sugar to rise. The pancreas is not making insulin. Your body needs to process the sugar. This causes fatigue, thirst, and other symptoms. At school, each student with diabetes will have an individual health care plan and a diabetes emergency care plan developed by the school nurse. These plans summarize day-to-day care for the student and are based on the Diabetes Medical Management Plan received from the student's health care provider. Each school staff member who has direct responsibility for a student with diabetes will receive a copy of the student's individualized health care plan and diabetes emergency care plan. These must be available for substitute teachers or staff. Students with diabetes must check their blood sugar levels throughout the day by using a glucose meter. The meter gives a current reading of the level of sugar in the blood. If blood sugar levels are too low or too high, students can take action by eating, changing their activity level, or giving themselves insulin. The actions to take are outlined in the student's individualized health care plan. Low blood sugar is one of the most frequent complications of diabetes and can happen very suddenly. It occurs when a student's blood sugar level falls too low, usually as a result of taking too much insulin, skipping or delaying meals or snacks, not eating enough food, or exercising too long or too intensely, or a combination of any of these. It often occurs before lunch, at the end of the school day, or during or after physical education classes. At first, a student with low blood sugar may tell you that they have a headache, feel shaky or dizzy, or are hungry. They may tell you that their heart is pounding, their eyesight is blurry, or they have numbness around their lips. You may see that their skin color is pale. They may look like they're sweating. Their personality may seem changed, and they may appear irritable, anxious, or drowsy. What the student tells you and what you see differs from person to person and can be different each time the student experiences low blood sugar. The emergency care plan has been individualized to include the student's specific symptoms and actions to take. As soon as symptoms of low blood sugar appear, treat on the spot. Give the student a quick-acting sugar product such as 4 ounces or half cup of fruit juice, 8 ounces or 1 cup of sport drink, a half a can of regular soda, not diet, 3 to 4 glucose tablets, or 1 tube glucose gel. These items may be found in the student's backpack, school health office, or school cafeteria. Call for help. Call the school nurse. The student should not be left alone or sent anywhere alone when experiencing low blood sugar. If not treated, the blood sugar will continue to drop. The student may have difficulty answering questions or problem solving. They may report that they are blacking out or that it's hard to focus and they are having ringing in their ears. They may look uncoordinated and act uncooperative. Treat for the low blood sugar on the spot in the classroom. If not treated promptly, a low blood sugar reaction can advance to a more severe state within minutes. Remember, never send a student with low blood sugar to the health office alone. Stay with the student. In severe low blood sugar, the conscious student will be confused and may be aggressive. They may babble or not answer your questions at all. They may seem extremely upset and may not understand simple instructions like sit down. Do not attempt to give anything by mouth if they cannot swallow safely. Students experiencing severe low blood sugar are often unconscious and may have jerking movements of the arms and legs. This is a medical emergency. Act now. Remain calm. If they are unconscious or having a seizure, act immediately by laying the student on their side on the floor. Call for help by calling 911. Call your school nurse and let him know that you have a student with diabetes who is unconscious, unable to swallow, or having a seizure, and your location. Do not attempt to give the student anything by mouth. Stay with the student and provide the student with privacy by removing other students from the area. When the blood sugar level is high, the student must be allowed to drink water or sugar-free liquids. The body's natural response to high levels of sugar is to eliminate the extra sugar by using the bathroom. Let the student know that it's okay to go to the bathroom whenever necessary. Other symptoms are blurry vision, fatigue, poor concentration, nausea, and vomiting. High blood sugar levels can interfere with learning and motor performance and can lead to serious complications. Students and other school staff play important roles in helping students with diabetes in school succeed by understanding that changes in blood sugar levels can affect the ability to think, be mistaken for misbehavior, and negatively affect school performance. Each student with diabetes has different needs. Educational accommodations are outlined in the student's individual health care plan, 504 plan, or individual education plan. For example, teachers may need to provide alternative times for exams if the student is experiencing or recently experienced low or high blood sugar. When student absences occur due to diabetes-related care, teachers must provide instruction to the student without penalty. Liberal restroom and water fountain access may be needed. Teachers must follow the student's individual health care plan as developed by the school nurse. Remember to include this information for substitute teachers. It's very important that substitutes be familiar with students' diabetes emergency plan. They will need this information to recognize day-to-day needs of the student. Many students will be able to handle all or almost all of their diabetes care by themselves. Other students, because of age, developmental level, or inexperience, will need help from the school staff. Each student's care will be outlined in the individual health care plan. The school nurse is the most appropriate person in the school setting to provide care for a student with diabetes. However, this staff member may not always be available during the school day, during extracurricular activities, or on field trips. Diabetes management is needed 24 hours a day, 7 days a week. Diabetes emergencies can happen at any time. The school nurse or other qualified health care professional will be involved with education of appropriate staff and providing professional supervision and consultation regarding routine and emergency care of the student. The school nurse will plan for effective diabetes management at school. The individualized health care plan will address the following: checking blood sugar levels throughout the day, monitoring food intake, getting regular physical activity, and taking insulin to help keep blood sugar levels in the target range, planning for school-sponsored activities and class parties, and disaster and lockdown procedures. Other elements of diabetes management in school include planning for events outside the usual school day, planning for safe disposal of material that comes in contact with blood, and dealing with the emotional and social aspects of living with diabetes. One of the most important parts of diabetes management is regularly checking blood sugar levels. This involves pricking the skin with the lancet at the fingertip, forearm, or other test site to obtain a drop of blood. The blood is placed on a special test strip that is inserted in a glucose meter. The meter gives a current blood sugar level. Students check their blood sugar during the day, usually before eating snacks or lunch, before physical activity, or when there are symptoms of high or low blood sugar. Many students can check their own blood sugar level. Some will need supervision and others will need to have this task done for them. Each student's care will be outlined in the individualized health care plan. Blood sugar monitoring does not present a danger to other students or staff members when lancets and other materials that come in contact with blood are properly disposed of. The nutritional needs of a student with diabetes do not differ from the needs of a student without diabetes. Both should be eaten a variety of foods for normal growth. The major difference is the timing, amount, and content of the food the student with diabetes eats. The student's meals and snacks are planned to balance nutritional needs with the insulin and activity level. School staff must be careful not to tell a student they can or cannot eat a particular food item. Many foods can be worked into the meal plan. Check with the school nurse for any questions about the student's meal plan. The school nurse must be informed of any significant changes in food intake, such as a classroom party. Exercise and physical activity are critical parts of diabetes management. In addition to heart fitness and weight management, physical activity can help to lower blood sugar levels. Students with diabetes should participate fully in physical education classes and team sports. To prevent low blood sugar, they may need to check their blood sugar levels more frequently. Physical education instructors and coaches must be able to recognize and treat low blood sugar. A quick-acting source of sugar must always be available. A high blood sugar level may require the student to limit his or her level of activity. Instructions for how to treat a low blood sugar and when to avoid exercise for high blood sugar will be outlined in the Individualized Health Care Plan and Diabetes Emergency Plan. All students with type 1 diabetes take insulin. Students will take their insulin periodically during the day. Support the student's diabetes plan of care, which includes when to take insulin, where to take insulin, and proper disposal of syringes. Planning ahead for parties is important for the student with diabetes. While there is usually no forbidden foods for children or teens with diabetes, school parties often include foods high in carbohydrates and fats. Give the school nurse and parent or guardian advance notice of parties. Special foods or extra insulin may be needed. Students often view a field trip as one of the most interesting and exciting activities of the school year. Students with diabetes must be allowed to have these school experiences. Although it's not unusual to invite parents to chaperone field trips, parental attendance is not required. The school nurse, with the parents' input, will plan for each individual field trip for the student. The following items will accompany the student: the Individualized Health Care Plan, the Diabetes Emergency Care Plan, any other document the school nurse feels is appropriate, and all necessary routine and emergency diabetes supplies, including a fast-acting blood sugar source. The plan of care for extracurricular school-sponsored activities is addressed in the Individualized Health Care Plan, 504 Plan, or Individual Education Plan. Students with diabetes must deal with the usual developmental issues of growing and also learning to manage this complex disease. Be aware of the student's feelings about having diabetes. Many feelings happen with this new diagnosis. These feelings may be constant, occasional, or happen years later during stressful times. Diabetes management requires a huge change in lifestyle for the student and the family. This includes grieving the loss of how it was before the 24 hours a day, 7 days a week demands of diabetes care. Your role in supporting the student with diabetes is summarized in some handouts. Review your handout Actions for the Teacher, or Actions for the Coach or PE Instructor, or action sheets for other school personnel including the counselor, principal, food services, and bus drivers. Get your copy of the student's school plans, Individualized Health Care Plan and the Diabetes Emergency Care Plan, or other educational plans if applicable, such as the Individual Education Plan or the 504 Plan. You may want to get a pencil to write down these resources and websites for additional information on diabetes. Click below for more resources. This concludes the Level 2 module on diabetes care. See your school nurse if you're interested in additional information on diabetes.